According to the CDC, more than 38 million Americans have diabetes. That's 1 in 10 people in the US. 90 to 95% of those have type 2 diabetes, which has become a major health crisis. Thanks for joining us for this week's Health News You Can Use. I'm Dan Cohen. Joining us is Melissa McGuire, Program Director at the Cardiometabolic Center Alliance, founded by the St. Luke's Mid-America Heart Institute. Melissa, thank you for joining us.
Thank you.
And as a certified diabetes care and education specialist, I want to start with you explaining the two types of diabetes and why this is a growing global health problem.
Yeah, thanks, Dan. So type 1 diabetes traditionally was thought of as juvenile onset. We don't really use that term anymore, but what happens in type 1 diabetes is the body loses its ability to make insulin, a hormone that you need for glucose regulation and overall health. We can see young children to older adults get this. It's less common. Type 2 diabetes is very common, unfortunately, and we'll talk about why some of that is, but that's what we usually see middle age to a little bit older, although there is a link with obesity. And because we are facing an obesity epidemic in younger and younger children, we are starting to see small children develop type 2 diabetes as well.
Melissa, who has a higher risk of developing type 2 diabetes?
So as I mentioned, there is a link between type 2 diabetes and obesity, but there's also some genetic disposition to it. If you have family members who've been living with type 2 diabetes, or if you're female and have had gestational diabetes, you're more at risk. There's also some lifestyle factors that could play a part in that, being sedentary, carrying that extra weight. So it's sort of a combined risk factor that puts you at risk for developing type 2 diabetes.
Now, following up on that, there are more tools now than before to help monitor and manage type 2 diabetes. What are some of those new tools available, and how can utilizing them help patients?
Over the last 10 years or more, we've really seen insurgence of a lot of new medication classes that are not only treating glucose more effectively, but also have these effects across all of the different comorbidities you can see with type 2 diabetes. Those living with type 2 diabetes are more prone to heart disease, unfortunately, kidney disease, potentially even liver health issues. And so we now have medications on the market that treat not only glucose levels, but are very, very effective with weight loss, with potentially liver health, cardiovascular protection. Those would be those medications we've all heard so much about, GLP-1s. Mm-hmm. And the reason we hear about GLP-1 receptor agonists is because they have all of these different areas that they can target. So that's really been important. And I think another thing I've been really excited about are tools we can put in our patients' hands. And one of those are glucose sensors. Glucose sensors are about the size of a quarter, they attach on your arm. And you can actually see your blood sugar 24/7 by looking at your mobile phone or a device that comes with it. And patients can use those real-time glucose levels to help make decisions on meal sizes and activity and timing of medication. So really empowering patients to take control over that.
That's fantastic. There is a continued focus on cardiometabolic disease, and I want you to talk about why this is important and what we're learning about it.
There is such a link between diabetes and cardiovascular disease. And in cardiovascular disease, we also involve the kidney. And then it's their metabolic issue. We're now calling it cardiometabolic. Well, type 2 diabetes is a metabolic condition, as is obesity. So now we've learned about the link with all these conditions and really how there should be a singular focus on all of this as one disease state, because we find that we're having better outcomes when we treat everything at the same time and we're decreasing risk factors.
The St. Luke's Cardiometabolic Center has a unique approach. What is the treatment model and how do you help patients?
Yes, so we opened up a cardiometabolic centered focused clinic here about 7 years ago here at St. Luke's, and immediately saw really, really good outcomes with these patients. We were no longer just treating one aspect of their cardiometabolic disease, but all of the aspects, making it not only easier on the patient, easier on the clinician, and the whole care team to understand where we needed to go with these care plans for patients. And we saw really good results immediately, and patients having fewer poor outcomes that were related to all of these other comorbidities they have when they're living with type 2 diabetes.
St. Luke's also formed the Cardiometabolic Center Alliance, and I want you to talk about what that is and how this alliance aims to help patients not only in the U.S., but potentially around the globe.
It's been very, very exciting. Based on our outcomes here at St. Luke's and how we were impacting patients' care, we were starting to get questions from across the country from other healthcare practitioners saying, okay, how are you getting this done? And so with the help of St. Luke's, we formed the entity, the Cardiometabolic Center Alliance. which we currently have 19 non-affiliated health systems from across the country, large academic institutions, small rural, community-based, who are applying the model that we developed here to their own patient populations and seeing similar outcomes.
That's terrific. And I want to end with advice. What advice do you have for people with type 2 diabetes, or for those that may not know that they have it?
You can really take control, really take an active role in your healthcare plan. Having those open dialogues with your care practitioners and realizing that even if you are diagnosed, there are so many things you can do and healthy steps you can take to live a longer, healthier life.
All terrific information and great work being done here. Melissa, thank you so much again for joining us.
Thank you.
To learn more, you can visit stlukeskc.org/cardiometabolic. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.